Good afternoon, everyone, and thank you for joining me for a conversation with someone well known to many of us, Dr. Paul Farmer. Paul is co-founder and chief strategist of Partners in Health, the pioneering organization dedicated to community-based healthcare and treatment, especially focused on resource-stretched and starved areas and countries. He is also chair of the Department of Global Health at Harvard Medical School and chief of the Division of Global Health Equity at Brigham and Women's Hospital in Boston. Paul, it's great to welcome you to the 2021 Athens Democracy Forum.
Thanks for having me, Patrick.
Absolutely. Paul, you've been working to expand and improve healthcare across the globe for nearly 40 years. And the title of our conversation is Health as a Human Right. And I'm wondering, how much closer are we to global acceptance of health as a human right today compared to when you really started this work in the 1980s?
Well, I mean, I would say we're closer now than we've ever been before, in my lifetime in any case. And that's holding in the United States, where healthcare has not been traditionally considered a right. We're seeing it across Asia, in parts of Latin America, in Europe. And, you know, a lot of this has been spurred by the dramatic events of the last 18 months, I think. Seeing what it's like to get through a pandemic when you don't have a strong safety net has been an object lesson for many.
Paul, in terms of the pandemic, certainly the United States, for instance, there is still, to some degree, a difference of opinion in terms of responsibilities for what the federal government should do, what states should do, what localities should do, what kind of rules should even be in place. And it feels like healthcare as a human right sometimes isn't enough of that conversation. Why do you think that is still the case in the United States and some other countries as well?
Well, I think it's just one of many paradigms that can be used to promote health equity. The others, for example, public health as a public good, are important as well. The idea that there are certain things that a federal government takes responsibility for. And in many of the places where I've worked, for example, in Rwanda, where the real impetus for investing in a national health insurance system and the rollout of a care delivery system has also been premised on the notion that this is the best way to break the cycle of poverty and disease. So whether you're looking at health as a human right or public health as a public good, or as health safety nets as a way to break the cycle of poverty and disease, they're all leading in the right direction. Now, there are many, many setbacks. Obviously, the pandemic is also a setback, but it's been a call to arms nonetheless for people with very different views. And as you know, Patrick, in our country, this tension between local and federal governments has been going on since the beginning. And sometimes it takes an event like this or the depression, that began in 1929 to spur some reforms. And on top of that, of course, we have a long overdue moment of racial reckoning in the United States. So all these things coming together, as others have said in the course of this forum, are spurring some real soul searching on the policy level.
Paul, does it surprise you that there has not been, over the last 18 months, more of a consensus in the United States and some countries in terms of how to approach not just the treatment of COVID, but the cost and expense of healthcare for people, especially people who have faced inequities in the healthcare system before? Or is that lack of consensus just part of, let's say, in some ways, a functioning democracy? How do you see that?
Well, I think there are all kinds of functioning democracies. I mean, maybe not enough of them, but there are other variations on the theme. Our struggle between federalism and local rule, as has been pointed out, has been going on for some time. And I think what we have to reckon with as a nation is, why have we done so uniquely poorly in responding to COVID? After all, we have more resources than most places in the world. And part of that has to do with our patchwork health delivery system, our patchwork health insurance systems, right? Which are also a reflection of this longstanding tension. Yes, there are some cultural issues, right, about notions of libertarianism, a longstanding history of hostility to government efforts to intrude in people's lives. But again, I don't know that these are singular, whereas our patchwork healthcare system is singular, and also our failure to invest in public health over the last several decades. We can chart really massive divestment in the project of protecting everyone. So I know that I sound a bit like an optimist looking back on the reasons for the holdups and the strange contours of our national conversation, but I remain optimistic that we're going to move things forward.
Paul, you've been involved for years in partnerships, public, private, the donor community, governments to bring healthcare resources, clinical support to countries around the world. What do you think President Biden and the Biden administration need to do now to deal with the global vaccine need and campaign? Because there is a real debate in the United States about whether more people who've had the shot need boosters or whether more can be done for other countries, much more can be done for other countries.
Well, first of all, I do want to say on many scores, I think the Biden administration is off to a pretty robust start. But there are lots of things. Obviously, our criterion for defining success is a high rate of vaccination, and we don't have that. Some of the specific issues are around technology transfer so that there can be manufacturing of vaccines, particularly on the continent of Africa. I would say there you have a setting where there's a total reliance on imports of vaccine. 99% of the vaccines used in Africa are imported, and also a very low level of uptake of vaccination that cannot be blamed on hesitancy, unless we're talking about elite hesitancy to put in place mechanisms that will roll out the vaccine. So there's an area, manufacturing, tech transfer, where the Biden administration could do more. Donations are still not working as a means of vaccinating large parts of Africa. The multilateral mechanisms that, though admirable, haven't functioned well enough. So there are lots of areas, I believe, where the Biden administration can make vaccine equity and vaccine diplomacy central. And this is for the worldwide struggle. I also think that there are places nearby the United States, like Haiti, which have been struggling with political disruption, natural disasters, and now a wave of refugees being returned to the middle of a crisis. These are also settings in which we should do a better job making sure we can help on the COVID front, but also on the many other challenges that are facing Haiti. And it varies from place to place, right? So I think there's a lot more to be done, but I would focus on building local health systems. And you could say, well, that's not the job of the United States, but as President George W. Bush showed with his AIDS relief program, these can have an enormous impact across the continent of Africa. There's been major progress made in Africa. A lot of people don't know that over the last 10 years, and even longer in some places like Rwanda. So this is aid that is not throwing money into a bottomless pit. It's investing in local capacity to build stronger health systems. That's what's going to help prevent the next pandemic, is stronger health systems everywhere, and of course, particularly where they're weak.
Paul, you sort of read my mind, and if I can follow up just quickly on that, on PEPFAR, I was going to ask you about, you've talked a lot about PEPFAR as a really successful model, given George W. Bush, some due around that. Is there a specific program or policy apparatus or kind of aid or a special envoy, something within kind of, in some ways maybe inspired a little bit by the success of PEPFAR that America and other countries could do to help in terms of that global vaccine effort?
Well, there's a lot of really fine people working on this. I've been lucky enough to train some of them as physicians. And I don't doubt the caliber of those professionals' engagement or the motivations at all. But all of the mechanisms that you mentioned could give us a little bit more purchase as we try to roll out the vaccine while paying attention to the health systems. What we've seen in the United States over the last 18 months, where people are dying not with COVID, but really because of it, because they can't access the regular medical services, even surgical care and chemotherapy, for example, or other cancer care. You're seeing that all over the world. So the cost of COVID has been even greater than we acknowledge looking at case counts, right?
Oh.
So all of those mechanisms, a special envoy internationally, a real focus on tech transfer, elevating this to the level of PEPFAR, I think would be very welcome. And the real secret of PEPFAR's success, in my view, was acknowledging the demands for health equity, but also investing in health systems. So, for example, if suddenly the US government says we're going to make AIDS treatment available across big parts of Africa, and there are no functioning health systems there at the time, they have to be built in order to do that. And that's what happened. Now, some of them are built very robustly, like Rwanda's, others more weakly, like some in West Africa, but it works every time. So more of that would be welcome. And, I don't think that polls show the American people hostile to that kind of engagement. On the contrary, some would argue that this is George W. Bush's most important legacy. I would.
Well, I think that's right, and I think also Americans like to see some kind of sort of commitment around leadership on these issues. We had Times Opinion had a guest essay recently by someone calling for George W. Bush to be a special envoy on global vaccine. You could imagine, W. and Bill Clinton with their relationship kind of teaming up. I mean, there are ways of kind of animating energy to at least kind of focus attention on this. And I've sort of wondered why, it's interesting, Joe Biden's got a lot on his plate, but those sorts of symbolic, maybe some call them theatrics, he doesn't sometimes go for. Do you think he should?
Well, what could be more less symbolic and less theatric than putting 16 million people on therapy for AIDS, most of them
Right.
still alive years later. So as long as the rhetorical flourishes are accompanied by real action, I think they would be welcome. And real action means vaccines delivered, technologies transferred, health systems supported. There are all kinds of ways of measuring this that we really didn't have in 2002 when PEPFAR came into being.
Right.
And, I think health ministries, though weakened by COVID, are probably stronger than they were at the close of the last century. So, I think some of these rhetorical flourishes would be welcome as long as they're linked to real pragmatic interventions.
Paul, I have sort of a hard question for you. It's something I'm puzzling over, but it goes to our topic of health as a human right, and that is about you touched on earlier the percentage of people vaccinated, and that some in America believe that Americans' percentage isn't high enough, that we were told about herd immunity, we don't have enough adults being vaccinated, it should be higher. And yet in many parts of the world, the vaccine rate is a fraction of what is going on in the United States. Are Americans being selfish when we think about wanting our vaccine rates to hit 80 or 90%, and so many parts of the world are small fractions of that, if this is supposed to be a human right for everyone, not just for Americans?
It is a tough question, Patrick. I have a lot of patients, American patients, who have reached out to me about boosters, and in many cases, these are patients who would benefit from a booster by any kind of criteria. And it's a shame, given all the vaccine that we have stockpiled, that we're considering this as a zero-sum game. If it were, a zero-sum game. If there really were some rare material involved in the manufacture of the vaccine that had to be mined from miles under the earth or something, you could understand that logic. But right now, we're not even bumping up hard into vaccine hesitancy in most places in the world. We have people lining up
Right.
for scarce vaccines. So I'm reluctant to say that there's a direct link other than a metaphorical and moral one, and those are important, between immunocompromised patients and elderly patients in the United States getting a booster and Sierra Leone getting its early doses of vaccine. My experience, Patrick, and you know how long I've been at this, my experience of the American people is that they're remarkably generous. And of course, I read the same newspaper you do. Actually, you write for it. And the stories are often bleak, right? But in my line of work, which is thinking about health as a human right for people who are very often not anywhere near our shores, I really see the generous side of the American people. I think we should draw on that,
Yep.
and remind people of our good fortune. As far as herd immunity goes, we heard about herd immunity all the time with other pathogens, from Ebola to smallpox. And, it is a real thing, I've no doubt, but it's different between bacteria, viruses, obviously, well, I say obvious, in my line of work, it's different with parasites. But the point here is that, we can't rely on herd immunity. We have to rely on suppressing the outbreaks. And we're not even using the vaccine to do that yet. We're using the vaccine to roll out protection based on perceived risk. But there are other ways to use vaccines too, to respond to outbreaks and clusters, as was done to control and eventually eliminate smallpox. So I think there's a lot of discussions that we still aren't having, and we're kind of focused on the booster discussion, and I understand that. And I certainly understand the head of the World Health Organization's demand that we be careful about thinking about a third dose for some and zero for others.
Yep.
But we do have enough vaccine if we take seriously the idea of a global vaccine rollout, not a national one. And as you know, Patrick, our responses to COVID have been almost wholly national responses.
Right.
So they haven't been global, even though the pandemic is by definition global.
No, it is interesting. I mean, again, the panel topic being health as a human right, and yet each country has its own approach and definition to that. And, covering the 2020 presidential campaign, Bernie Sanders talking about health care, as a right, not a privilege, is something America, some Americans talk about. Others, want that third shot for themselves. And I agree with you on the generosity, but it's a moral issue that I think a lot of us are struggling with.
Yes.
I have an 86-year-old mother with Alzheimer's, and I have a partner who's a physician assistant. Both of them in the last week have been told that they qualify for the third shot, and we found ourselves in our family talking about, why us, when so many, haven't had the first one. But now I'm editorializing a little bit. So, Paul, before we run out of time, I of course wanted to talk to you about Haiti, where so much of your work, has been, and just with the latest earthquake there and the migration challenges that we've all seen in photos and on the news. You've been working there, visiting Haiti for 40 years now. As you see it, what is the story that the global audience needs to understand about Haiti right now in terms of health, in terms of what can be done to support people there?
Well, I just returned recently from Haiti, and I will say, and this might surprise some of those at the forum, but I found it a very uplifting trip. And in part, or in large part, because the approach of investing in Haitian institutions, which did not occur on a national level after the last earthquake of 2010, but an organization that you know well and have written about, Partners in Health, that's what we did. We invested really all of our resources into building up Haitian institutions. And so what I saw, which is different from what many saw in the earthquake zone, is I looked around and I remembered that in 2010, Haiti had never had an emergency medicine training program. But I looked around and saw my former trainees and young colleagues, most of them young women, who were fully trained emergency medicine doctors or fully trained trauma surgeons or fully trained community health workers focused on mental health. I saw all that in the earthquake zone and certainly up in the area where we work. So what I would say in response to that question, Patrick, is the way that we can help Haiti is by helping to invest in Haitian institutions. And even when their political institutions have fallen apart, as they clearly have, in my line of work, investing in Haitian health institutions, including the Ministry of Health, is an important way to pursue the goal of, a life with less want and fear and illness in it for the Haitian people, which is what I think, all of us would like to see, or many would like to see. So I found it uplifting and an affirmation or a confirmation of the views that we should be spending more time, more of our resources, building up Haitian institutions. And the same holds true across much of Africa.
Paul, we're almost at time. I have a virtual question, but just want to see if anyone in the audience here in Athens had a question for Paul. So the virtual question, just very briefly, Paul, because I know we're almost out of time, is just how do you avoid burnout in the work that you do? Because you've been going hard at it and you travel like nobody's business. Tips for people who have the same kind of commitment, but boy, it's an exhausting time to be at work in the world.
Yeah. Well, a couple of things that I would say. One is, you're working with large groups of people. This kind of work never makes much of a difference if you're not part of a large team. The people I get to work with, even in Haiti, it may shock you, Patrick, as someone who knows a little bit about the place and our work. We have over 6,000 employees in Haiti, all Haitian. And so, far be it from me to get burnt out when they're the ones working so hard on responding, for example, to an earthquake, or a flood, or a storm, or some other problem, or even a bad car accident, right? So that's one secret. Another is, and this is almost like a trade secret, it should be so out there and then isn't, is that when you do devote yourself over time, and you put in the treasure and time, and you have the staff you need, and the stuff you need, and the space like a hospital you need, or a COVID unit, and you have the kind of systems in place that can make a difference, then you'll always see progress. So one of the secrets is stick with the work and you'll find real satisfaction in it.
That's great. Paul, thank you so much for joining us today.
Great to see you, Patrick, and thank you for having me.